Hello students, welcome to my channel Easy Learning. Today I am going to discuss the part 2 of conduct disorders and its nursing management. Let us start. This part includes treatment, that is medical management, psychosocial management and nursing management. So first let us go to the medical management. While treating a client with conduct disorder, a multidisciplinary approach is necessary, which includes psychotropic agents, behavioral modification, and family involvement. Before starting any medication, it is necessary to rule out any comorbid conditions like history of substance abuse, etc. through different laboratory investigations. Drug treatment is needed if the child or adolescent with conduct disorder has epilepsy, hyperactivity, or any kind of depressive symptomatology, etc. Next, psychosocial intervention is another important aspect of managing a case with conduct disorder, like contingency management program. It is a kind of behavioral modification therapy to promote positive behaviors among the individuals. Next is cognitive behavioral skill training or cognitive behavioral therapy. It is used to address the social cognition deficit and to improve different problem solving skills. Next, let us move to the nursing management. Nurses play a very important role in the management of a child or adolescent with conduct disorder. During hospitalization, the nurses are the healthcare member who can have a constant observation on the behavior of the child or adolescent with conduct disorder. And it helps her to make an ongoing assessment of the child's behavior. The nursing assessment includes number 1, that is assessment of risk for violence or aggressive behavior. She can also have an assessment of manipulative behavior, problem-solving abilities of the client. Another important area of management is the assessment of knowledge of parents regarding the disease condition and their coping skills while dealing with their child or adolescent. As already you have learned that the children with conduct disorders, they exhibit many kind of dissocial, defiant or disobedient behaviors, and it may be a difficult situation for the parents to handle this behavior in a home scenario. So assessment of their knowledge regarding the condition and their coping skills is very important aspect of nursing assessment. On the basis of these assessments, let us make some nursing diagnosis. This will be individualistic in nature depending upon the assessment. Let's learn one by one. Number 1 is risk for other directed violence. This diagnosis is applicable for the display of aggressive behavior towards others. The related factors can be characteristics of temperament, that is the child's specific behavioral profile. Next may be the peer rejection. It may be applicable for unsocialized type of conduct disorder group. Negative parental role model, that means like one example may be seeing the parents who involve in aggressive behaviors or aggressive activities like physical abusing, etc. Again, another related factor will be the dysfunctional family dynamics like marital conflicts between the parents. These all can be the different related factors for the risk for violence directed towards other. That is our first nursing diagnosis. I hope the first nursing diagnosis is very clear to you all. Let us move to the second one. Second one is impaired social interaction. This diagnosis can be made by observing the client interactions pattern with display of inappropriate social behavior. For example, being rude or angered while talking. Another related factor may be negative parental role model, that is, observing parents' negative social behavior or impaired peer relationship, which may be due to inability to form an effective social relationship with group or getting rejected by the friends, etc. Next diagnosis is defensive coping. This diagnosis can be made by observing the client blaming others for their own actions, which may be related to low self-esteem due to the feeling of inadequacies as well as dysfunctional family system, which we discussed already. Next diagnosis is low self-esteem. Due to lack of positive feedback, it may be from their parents or significant others. Another factor may be unsatisfactory parent-child relationship due to various reasons, for example, alcoholism in parents. Let us move to the last nursing diagnosis, that is ineffective family coping related to lack of awareness of parents about the child's condition or family's own dysfunctional dynamics due to marital conflicts, etc. Now, what will be the outcome identification for the client? The outcome identification will be they will not hurt others, they will demonstrate appropriate social behavior, the client is expected to learn effective problem-solving skills, coping skills, and to have a positive self-worth. For the parents, demonstration of effective parenting skills and coping skills will be the outcome criteria. Planning will be done to manage the aggressive behavior, limit manipulative behavior, and improve the problem-solving skills and to provide guidance and support for the parents. Next, let us discuss about the nursing care plan. First is the care plan for the risk for other directed violence. A keen observation of the behavior should be made. To handle any emergency situation due to aggressive behavior of the child or adolescent, the nurse should ensure sufficient number of staff available in the ward. Encourage the client to redirect violent behavior with various physical outlets, which are safe and effective way of releasing aggression like physical exercises, sports, etc. In extreme condition of aggressive behavior, chemical restraints, that is medication, should be given as per direction. If all the measures fail, mechanical restraint or isolation can be done as a measure to control aggression. Institution's policy for physical restraint should be followed strictly. Nurse should ensure circulation of the extremities while giving the mechanical restraint. She should ensure the needs related to the nutrition, hydration, elimination, etc. Another important nursing intervention is maintenance of a logbook with the client with daily entries of his behavior. This will help the nurse and the client to review the behavior or the situations that makes the client to exhibit inappropriate conduct. Next is the care plan for the defensive coping. A trusting relationship is necessary to proceed. Help the client to identify defensive behavior such as blaming and the situation that precedes the defensive behavior. Administer role play to practice acceptable behavior. Next, teaching problem-solving skills, another plan or the intervention for the defensive coping. So, what are the steps to teach problem-solving skills? Help the client to recognize a problem, then help to find the alternative responses, help him to select the adaptive one to deal more effectively with the problem. This can be done through the role play. Next, let us move to the care plan for the low self-esteem. While dealing the client, convey an accepting attitude. To improve self-confidence of the client, set short-term realistic goals which are achievable. Plan activities that provides opportunities for success. This can be planned after assessing his strength in different activities and focusing on those plan can be made. For example, if a child is good at making kites, then activities can be planned with those activities which includes a task of making kites. So this will help him to attain the self-confidence. Positive reinforcement should go with the activities. Next is care plan for the ineffective family coping. Family may not be able to cope due to the inadequate knowledge on the disease process or due to the inadequate parenting skills. So, psychoeducation is an important nursing intervention to help them to accept the situation and to gain knowledge regarding the disease process. Encourage them to verbalize feelings of guilt and helplessness. Involve parents in planning management of difficult behavior of the client. It includes development of clear rules and behavior. Here, the nurse, with the help of the parents, should construct rules about the social behavior, and the parents can use various disciplinary alternatives like timeout or the removal of privileges for the child when they are not displaying or not following the set rules or the conduct. The nurse should make the parents learn different kind of alternative disciplinary techniques. The parents are encouraged to spend a quality time with the child or adolescent to improve the parent-child bonding. Listening to the child is very, very important. Positive reinforcement, for example, like applauding the child's effort verbally for the acceptable behavior, should be taught to the parents by the nurse. Next, finally, the evaluation step. So here evaluation is made on the basis of behavior changes that occurs in the client. This is accomplished by determining if the goals of the nursing intervention have been achieved or not. Reassessment should be initiated if set goals are not met. So in the conclusion, a multidisciplinary approach is needed to manage a client with conduct disorder. Nurses play a significant role to improve the child's behavior in collaboration with family. A continuous nursing assessment and planning is necessary to meet the set goals in the nursing process. Here is an assignment for the students to write a plan of care for a client who is of 12 years old and who got admitted with the chief complaints of setting fire, aggressive behavior, breaking properties, running away from school, and stealing behavior. He also has a family history of marital conflicts of parents, domestic violence, and his father is a chronic alcoholic. These are a few references from where the content has been taken. I hope the nursing management and the plan of care for a client with conduct disorder is made clear to you. Thank you so much.